Young children are notorious for falling down and hurting themselves, and one of the most common places where they get lacerations or injuries is in their mouth. So here are some tips and tricks of what can you do if they cut inside their mouth, when do you need to seek medical care, and when is it a true emergency? There's a few different kinds of injuries that we'll talk about. The first one is an upper frenulum, and I'll put a picture here. That is a little piece of tissue that connects the inner part of your lip to your gum line. And some people have a rather large one, and it goes in between their front two teeth. This is a really common place when children fall. The upper lip goes up and it pulls and causes this laceration. This almost never needs to be fixed. It's actually something that over time, if you look at yourself as an adult, your upper frenulum has gotten smaller and smaller. And in some cases, the dentists snip them if the teeth won't close, or if we're having trouble with breastfeeding or feeding, we clip them in newborns. So you don't need this. It's okay if it gets torn. Stop the bleeding with a popsicle or a piece of ice. If it's a young child, you want to just try to hold some pressure. It stops bleeding really quickly. If you can get them to put something cold in their mouth, it helps. Tylenol or ibuprofen if they're in pain. Call your doctor if it's not healing within 3 days, or if you can't get the bleeding to stop within 15 minutes. The next one that we're going to talk about is a tongue laceration. Tongue lacerations are also really common in kids because they fall and they bite through. Lacerations in the middle of the tongue like this that are less than 2 centimeters in size, they do not need stitches because the mouth is one of the fastest healing parts of the body because there's so much blood flow to it. Most injuries in the mouth within 3 days are completely healed. So the stitches would just get healed right over. So most of the time we don't need them. So what you want to do when this happens to your child, if it's a dirty wound, say they fell in a bunch of dirt or something else happened, you want to try to clean it as best you can. You can just rinse it with some water. Again, give them something cold to stop the bleeding. Keep some popsicles in your freezer. Immediately give them a popsicle. The sugar soothes them. It stops the bleeding. They're more likely to put it in their mouth. And if you can get the bleeding to stop and get a good look at it, most of the time it doesn't need stitches. So the reasons it would need stitches: if it was greater than 2 centimeters, and again, not always, but you want to go in. If it won't stop bleeding within about 30 minutes, if it's through the tip or sides of the tongue, the tip almost always, the sides sometimes need stitches. And also you might need stitches if it goes completely through and through, but not always. Other things to consider, obviously, if this is an animal bite, they need to seek care regardless because they're so much more likely to get infected. The child would need antibiotics. The next thing is palate injuries. So we talked about this in one of my other safety videos, to never let your children run around with anything in their mouth because we see a lot of palate injuries. If there is any puncture to the palate, that can be a medical emergency and you need to take them in. If there's just some bruising, they're acting fine, they seem good, they will eat and drink, they're not in pain, you can just monitor at home. I hope these tips help. If you have any questions specifically about mouth injuries, except the teeth, because I'm not a dentist, put them in the comments.